Hello everyone. Today we are going to discuss about intercostal nerves. Here you can see a spinal cord. This is the area which give rise to intercostal nerves. You can see T1 to T11 spinal nerves arises from this area. So the intercostal nerves are the ventral rami of T1 to T11 spinal nerves. These are the T1 to T11 spinal nerves. Their ventral rami are called as intercostal nerves. Here you can see a intercostal nerve. Here you can see this is the thoracic vertebra. This is the vertebral canal where spinal cord is traverses. You can see spinal nerve coming from this area. This is the spinal nerve. And this is the ventral rami of spinal nerve, and this is the dorsal ramus. This is the ventral ramus, this is the dorsal ramus. So we call this ventral ramus of the spinal nerve as intercostal nerve. Here you can see ventral ramus of the spinal nerve, we call it as intercostal nerves. So as you can see here, usually neurovascular bundle goes through the goes in between second and third muscle layers. Here you can see external intercostal muscle, outer layer. Then you have internal intercostal muscle, second layer or middle layer. Then you have inner layer, innermost intercostal muscle or third layer. You can see this intercostal nerve goes in between second and third muscle layers. When we talk about the intercostal nerves can be divided into two groups as typical intercostal nerves and atypical intercostal nerves. Typical intercostal nerves are the spinal nerves T3 to T6. That means T3, T4, T5, T6. Intercostal nerves are the typical intercostal nerves. Then the atypical intercostal nerves are T1, T2, T7 to T11. That means T7, T8, T9, T10, T11 and T12 intercostal nerves. Those are the atypical intercostal nerves, and typical intercostal nerves are the T3 to T6 spinal nerves. First of all, we will discuss about the features of a typical intercostal nerve. So, when we talk about the cause of a typical intercostal nerve, those intercostal nerves are emerged from the intervertebral foramen. They are emerged from the intervertebral foramen below the numerically corresponding vertebra, inferior to numerically corresponding vertebra. As you can see in this picture, this is the T4 vertebra and this is the T4 spinal nerve. So, intercostal nerves emerge from the intervertebral foramen inferior to the numerically corresponding vertebra. Each nerve then passed below the neck of the numerically corresponding rib. Here is the numerically corresponding rib, and then it goes below the numerically corresponding rib and enter into the costal groove or subcostal groove. From my previous video, the anatomy of ribs, you have learned what is the subcostal groove or costal groove in a rib. So this neuromuscular bundle lies in this costal groove or subcostal groove in a rib. Imagine this is the costal groove or subcostal groove. Then from above downwards, so in a subcostal groove, the intercostal vein, intercostal artery and intercostal nerve lies as this. From above downwards, you have intercostal vein, then you have intercostal artery, then you have intercostal nerve. This is the arrangement of the neurovascular bundle in a costal groove. We call this as van. There is a mnemonic called van. That means above you have intercostal vein, then you have intercostal artery, and then you have intercostal nerve below. Here, I told you previously, this is the external intercostal muscle, then internal intercostal muscle, then innermost intercostal muscle. This external intercostal muscle continues as anterior intercostal membrane. This internal intercostal muscle posteriorly continues as posterior intercostal membrane. So, in the posterior part, in this part, you can see the nerve lies in between this posterior intercostal membrane and parietal pleura with the endothoracic fascia. In the posterior part of the subcostal groove, the nerve, intercostal nerve, lies in between posterior intercostal membrane. Here, this green color one is the posterior intercostal membrane, and parietal pleura with the endothoracic fascia in this part. Then, in the middle of the course, the nerve lies in between second muscle layer and third muscle layer. That means internal intercostal muscle and inner intercostal muscle. Then, closer to the sternum, here in this part, closer to the sternum, as you can see here, the nerve pierces the internal intercostal muscle and anterior intercostal membrane or external intercostal membrane and goes anteriorly. You can see the nerve goes anteriorly by piercing the internal intercostal muscle and anterior intercostal membrane, which is the extension of the external intercostal muscle. So then it is terminate as the anterior cutaneous nerve. Here you can see it is terminate as the anterior cutaneous nerve, and it divides into lateral and medial branches. It terminates as the anterior cutaneous nerve and divides into lateral and medial branches. Then the other branches are, you can see the muscular branches given for the external intercostal muscle and then internal intercostal muscle as well as to the innermost intercostal muscle. You can see the muscular branches here. Then you have a collateral branch. I'll show you in this picture. This is the collateral branch. This is the collateral branch. Here you can see the collateral branch. It goes like parallel to the main branch. This is the collateral branch. That collateral branch arises at the arises to the near to the angle of the rib and run along the upper margin of the rib below, and it may rejoin the main stem or sometimes it may not. Then you have sensory branches like lateral cutaneous branch and the terminal branch, which is the anterior cutaneous nerve. They are the sensory branches. This lateral cutaneous branch also further divides into anterior branch and posterior branch. This lateral cutaneous branch arises beyond the angle of the rib and then pierces the internal intercostal muscle and external intercostal muscle. You can see it has pierced the internal intercostal muscle and external intercostal muscle, and then it is distributed to the skin after dividing into anterior branch and posterior branch. Then the anterior cutaneous nerve emerge on the side of the sternum. You can see by piercing the internal intercostal muscle and external intercostal membrane, and it supplies the overlying skin after dividing into lateral branch and medial branch. So those are the branches of a typical intercostal nerve. Here in this picture, this is the posterior aspect and this is the anterior aspect. You can see the vertebra and you can see here sternum. Here I will talk about the intercostal nerve block, the clinical aspect of neurovascular bundle. It is the intercostal nerve block. We give local anesthesia to the intercostal space, and then it is infiltrate around the intercostal nerve trunk and its collateral branches. Here we give local anesthesia to the intercostal space. Here around this area we give local anesthesia, and then we can block the main trunk as well as collateral branches. So when we give intercostal nerve block, the needle is directed towards the rib near the lower border and tip comes to rest near the subcostal groove. We insert the needle towards the lower border of the rib, near the lower border of the rib. Then needle will pass the first the skin, then the superficial fascia, then the serratus anterior muscle in the pectoral region, then external intercostal muscle, then internal intercostal muscle, then innermost intercostal muscle, then endothoracic fascia, then parietal pleura, and goes to the nerve trunk. So there can be some complications of intercostal nerve block as well. They are sometimes can be pneumothorax or sometimes can be hemorrhage, which is caused by puncturing of intercostal blood vessels, because this neurovascular bundle goes together like above vein, then artery, and then below nerve. So the arteries can easily be damaged from these intercostal nerve blocks. So that is the clinical correlation about the neurovascular bundle. That means intercostal nerve block. I told you earlier there are some atypical intercostal nerves as well. They are T1 or first intercostal nerve, second intercostal nerve, and T2 to T7 to T12 intercostal nerves. T7 to T12 intercostal nerves. So here from this picture you can see the T1 intercostal nerve here, the ventral ramus of T1 spinal nerve, first intercostal nerve. You can see C8 has been joined with this T1 ventral ramus. Here you can see C8 has been joined. That means C8 means the nerve which arises from the brachial plexus. So the first intercostal nerve has no lateral or anterior cutaneous branches, and it crosses the first rib to join the brachial plexus. This first intercostal nerve, there is no lateral or anterior cutaneous branches. It joins the brachial plexus. Then I told you the second intercostal nerve is also atypical nerve, because the lateral cutaneous branch of the second intercostal nerve is known as the intercostobrachial nerve. Here you can see these are the anterior and posterior branches of the lateral cutaneous nerve. Anterior and posterior branches of the lateral cutaneous nerve of intercostal nerves. So the lateral cutaneous branch of the T2 intercostal nerve is called as the intercostobrachial nerve. It is a large lateral cutaneous nerve which supplies the skin of the floor of the axilla. It supplies the skin of the floor of the axilla and the upper part of the medial side of the arm. It supplies the floor of the axilla and upper part of the medial side of the arm. Then the other atypical intercostal nerves are the nerves T7 to T12. So here you can see T7 to T12 intercostal nerves here. Here this area. We call this as atypical intercostal nerves because the anterior cutaneous branches of these nerves enter into anterior abdominal wall. Here you can see they enter into anterior abdominal wall at the anterior end of the intercostal spaces, and they pierce rectus abdominis muscle. Here there is a muscle called rectus abdominis muscle here in this area, and it pierces the sheath of the rectus abdominis muscle as well, and then it reaches the skin. So we call these nerves also atypical nerves, because the usual intercostal nerves, they do not pierce rectus abdominis muscle or the sheath of the rectus abdominis or anterior abdominal wall or to reach the skin, anterior surface of the skin. That's why they are not, they are typical intercostal nerves. We call these T7 to T12 as atypical intercostal nerves because they pierce anterior abdominal wall and give rise to anterior cutaneous branches. Those anterior cutaneous branches of uh, T9 and T10 intercostal nerve also supplies the skin around the region of umbilicus. Here you can see T9, anterior cutaneous branch of T9, and here anterior cutaneous branch of the T10. So this supplies the skin around the umbilicus. It is a very important clinical point. So that's all about intercostal nerves. Thank you for watching.